My name is Christopher from Malawi, which is a country far in the southern part of Africa. Currently working as a senior laboratory technologist in the National Genomics and Sequencing Reference Lab in the Public Health Institute of Malawi, which is a directorate in the Ministry of Health. Basically, our mandate is to take lead in disease surveillance, prevention, as well as outbreak response, and take lead in research so that we can inform our practice and risk policy. My research interests is more oriented toward clinical pathogen metagenomics based on high throughput sequencing. I'm kind of much interested in expanding my knowledge in understanding the pathogen identification as well as antimicrobial resistance prediction. Using the conventional methods that we have there, that's proven to be a little bit lagging in terms of the time it takes in order to confirm such outbreaks. But now coming here at BGI, we are learning that the metagenomics using high throughput sequencing is the way to go now because it's fast, it's accurate and efficient. Meaning to say, if we employ what we've been learning here, definitely my country will benefit a lot because we will reduce the delay that is there to inform the response of outbreak management. In our end, we are currently struggling much with outbreaks such as cholera. We're also experiencing a lot of HIV issues. Recently, we've been talking about mpox. It's quite very difficult in our setting where the clinicians are struggling to which antibiotics they can use to treat a patient without having a resistant profile. I was also very much interested in understanding on how we can use the genomics and sequencing to predict the resistant and maybe create a resistant profile. The knowledge and information we are learning about metagenomics on how we can quickly identify pathogens, how we can predict the antimicrobial resistance. These are critical issues that needed in either public health or as well as in the clinical setting. I feel like genomics and sequencing is the way to go, not only here in China, but even in Africa, and particularly in our country, Malawi. If we could employ the innovations and the solutions that BGI is offering, I think can strengthen our response mechanism. We should be able to detect outbreaks as quickly as possible. We can equally deploy that mechanism to predict the resistance pattern. I feel like much of the African public health systems, including ours in Malawi, will be very much influenced with some of the technologies that we've learned here. I really feel this is the center of innovation, and it's quite amazing to continuously hearing from such people who have accomplished almost everything in life.